All right, so let's get started. Wound contraction, the next step of the inflammatory response. I was actually assigned wound contractor, but I was not sure which one to actually do, whether it be wound contraction or wound contracture. So we're just going to go over both. So wound contraction, the definitions to the left, right by my cursor, if you can see it, concentric reduction of size of an open wound, which is pretty common sense if you just look at the words wound contraction. Contract meaning decrease in size, to contract. So yeah, just decreasing the size of the wound. In this case, it's like pulling it together. So yeah, it differs from wound contracture, where wound contracture is the process that may occur during wound healing when an excess of wound contraction, a normal healing process, leads to physical deformity characterized by skin constriction and functional limitations. So wound contraction should not be confused with contracture. Contracture is where the tissue's loss of ability to lengthen causes limitation in the joint's range of motion. So it's just kind of like a really tough tissue. It just didn't grow right, and it led to obviously a physical deformity. Wound contraction, let's get back to that. So we know it's concentric reduction of size of an open wound. So how does that go about healing and closing that wound? Well, we start off with myofibroblasts, which are on the marginal ends of the wound, and they kind of come together. Myofibroblasts are fibroblasts that have contractile properties, and they get these contractile properties from actin, which is contractile muscle protein. And like I already said, myofibroblasts are on the ends, these marginal ends, and they shorten to pull the ends of the damaged tissues closer together. And this kind of like seals the wound. All while this is happening, we also have other fibroblasts that are emitting like collagen type 3 fibers, which are weaker and very vulnerable to tensile forces. So if you do stretch them, it just opens the wound again. But yeah, that's how it goes. So hopefully we can kind of zoom in on this. Hopefully you guys can see it. But we'll cover this in this little diagram that I made. Step one, we see this little bloody wound. The dark red is representing of the marginal end of the wound where these myofibroblasts would be. So it starts off, we go over to step two. The pink is representing of that collagen type 3 tissue, aka scar tissue, that's starting to close and the skin starting to stretch. And we see these myofibroblasts starting to move inward to seal the wound. And then finally, three, whoops, this was much. All right, three, that red line is representing of the wound being closed, and the pink is representing of just the scar tissue that's left over from this whole process. So yeah, pretty easy, pretty common knowledge. But yeah, wound contraction.